Arganisima, New York. Your exotic skin, hair, and beauty source, and your one-stop shop for all your natural and organic skin and hair care, featuring authentic organic Moroccan oil and prickly pear seed oil and much more. Bringing you only the best, straight from the source and proudly produced in the USA. So what are you waiting for? Shop today at www.arganisima.com. Arganisima, New York. Your beauty is our duty.
Folks, welcome back to the iHealth channel, iHealthradio. Today is going to be a unique show because this is our announcement, of a new partnership that we're going to have on the channel and the radio with a previous guest and a friend. And you've probably seen some of the ads, or at least some of the promotional stuff on the website, on the actual social media. And really, we're bringing a show that was in place and, was led by our dear friend, Doctor. And, I'm still holding the name right now. But she has been with us already. We had a great show before and we've been in touch. And I follow her. She follows me. And we're doing a lot of good stuff here on social media. But really, we thought that, her program can also be used and really shared on our platform, on the channels and on the EMBC network. And so without any further ado, it's Let's Talk About It is the actual name of the show and the series. And of course, with the one and the only Dr. Cheryl Denise BryantBruce. And she's really gonna, take it over. I mean, this is really her thing. Just to be clear, I'm gonna be the guest today, believe it or not. So I'm gonna be the first one. But really, this is gonna be something that's gonna air on our channel and all streams. But it's gonna be led by Doctor. And frankly, it's going to be fun because if you have followed the on the radio, at least you've probably heard the series about love, and especially Valentine's. There were some super shows that we had, or they were long, but they were very powerful shows, and we had them repeat, and we probably keep repeating them every Valentine's or any emotional day, I'd say, where it has to do with family and loved ones. So we'll keep up that. But really, her show is Let's Talk About It. So we're going to talk about things, and she's going to talk about things. So she's going to have guests that talk about things. And she flows always on the mental health and some medical stuff, and she really covers a lot of background. So that's it for me. Doctor, welcome back.
Thank you. It's great to be here, and I'm excited about this partnership. I definitely appreciate the work that you do on iHealthradio. You have a great show and you bring some great guests. So it is very exciting to be a part of this partnership. Chatters That Matters, Let's Talk About It, is a revamp of the old show that we had on BlogTalk Radio, Let's Talk About It. The idea behind it was that everything that we do affects our health and particularly our mental health. So it didn't matter whether we were talking physical health like hypertension, or we were talking social health, what's going on in social media. I mean, for example, we might talk about things like the recent slap of Chris Rock by Will Smith and what might have been going on in Will's head and how that impacted us as an audience watching it. A lot of people were disturbed about it. So we talk about things like that. We talk about how politics are affecting people. A lot of people are very disturbed about the things that are going on in the Ukraine. A lot of people worrying about whether Putin's getting ready to push the button. People are still talking about COVID. There's a lot that goes into that. People are worried about their physical health. A lot of people have that COVID spread going on. And so they're trying to figure out how to get it back together. And I mean, I have to say at this point that I'm very impressed with you, Hurricane. I've been watching those TikTok videos of you working it out. So setting a great example for everybody to get rid of that COVID spread. So, I mean, that we talk about a lot of different topics. The talk that we have about relationships is always a very, very popular one, because it doesn't matter how well we're doing relationships, we all always feel like we can do them better. And it's nice when you can get expert advice from couples who have stood the test of time, because so many relationships aren't withstanding the test of time now. So we talk about all sorts of different things, and this is going to be an exciting show. We want to talk about the things that are most interesting to our audience, however. So we encourage people to reach out, tap on us, tell us what you want to hear about, what burning questions that you have that nobody's answering. We don't care if they're controversial or not. Sometimes the more controversial, the better, because you end up with better discussions that way. So we're looking forward to some exciting conversations. And we are going to start this first premium episode of Chatters That Matters. Let's talk about it with you, Hurricane H. And we are talking about things that impact health. And one of those things that is an important aspect of health is being able to pay for health. And so most people in the United States, at least, are paying for health with some form of health insurance. I mean, there are a lot of people who are uninsured and who are paying for their health care out of pocket, and who are paying for their wellness care out of pocket, which is something that we really want to start seeing people doing more, paying for well care so that they don't have to pay for sick care. But let's talk about how we do that. What is this whole big insurance animal that nobody really understands very well? And why am I asking you, Hurricane H? Because I know that you were on the backside of the insurance business. So tell us, inform us, instruct us. How do we handle this insurance bear?
Well, we're gonna get to that. Well, first thing, I just wanted to touch back on your intro about the show and Chatters That Matter. Let's talk about it. Again, we're excited. This is going to be great. And, beyond me, you'll have plenty of guests, and, we're going to share a lot of good stuff and good vibes, and definitely, controversial or not, we want people to reach out. How can people reach out to you, just so we can announce that? And then I'll put the link, of that, so people can reach out to you and get their questions or whatever topics to you. Is there any particular way you want those to happen?
There are actually a number of ways that people can reach out to me. I do have very active Instagram account, and so you can always hit me up on Instagram. The Instagram, I don't know what they call it. Yeah, that little ampersand that they use, that tag is Cheryl BryantBruce, MD. So it's just at Cheryl BryantBruce, MD, my name, or you can use at the Celebrity Doc, and both of those will get to me. I also have a Facebook presence at Cheryl BryantBruce. It does not have the MD, and that's an important thing to know. If you're going to be looking for me on Facebook, I do have a Facebook presence, and you will find a site under Cheryl BryantBruce, MD. That is no longer an active site. You'll find lots of information there, and you can go through and read that and enjoy it, but that is not an active site. There is a page, however, the Celebrity Doc, and the celebritydoc.com. You can reach us there, but the actual Facebook page to reach me on is Cheryl BryantBruce. One of the fun places to reach me is on TikTok.
I was going to say that.
I'm TikToking. Hurricane is TikToking. Everybody's TikToking now. But on TikTok, I am Dr. Cheryl MD, Dr. Cheryl MD. And, you can also punch over onto Hurricane's page and track backwards to me, and you can punch onto mine and track backwards to Hurricane. So you can definitely find us there. And there is the website. The website is thecelebritydoc.com. thecelebritydoc.com. And also you can find me again under my name, Cheryl BryantBruce, MD.com. So there are lots and lots of ways.
That's a lot of, conduits to you. That's a lot of ways to reach to you. And
Yes.
that's great. And again,
basically, if you punch onto Google me, you'll find me all over the place, because I am fairly active on social media, and there's a lot of stuff popping up right now because I am doing speaking engagements in different places, and we are going to start actively loading those onto a calendar on the website so that people will have access to knowing where I'm speaking if they want to follow that. And the social media will also be listed on the website so that it'll make it easy for people to access me. But again, like I said, if you want to find me, Google me, I'm there.
You're readily, easily available, and that's great. And you can also reach out and send any comments or whatever to our email, hurricaneh@iHealthradioUSA.com, and we can forward that to Doctor, and she will get the information and use that, whether to answer the questions or maybe use them as a topic for one of the shows. So stay tuned. These will be coming on, and also catch them on whatever we stream. So anything that is audio visual, you're probably going to hear it. So all the podcasts, they will be live, recorded there. And also if you on YouTube, Vimeo, Fire TV, Roku TV. So there's a lot of places you can do this. But now let's get back to the question or the discussion topic today. So you posed a very important.
Actually, I'm going to interrupt you for just 1 second.
Yes.
I do have a phone number. If you all are coming onto the, you're Googling and you're coming onto any of the sites and you find a phone number listed there right now, if you call that number and you don't get an immediate response, then please reach out to us with one of the other methods, because right now my assistant, who normally is answering those phone lines, is in the hospital. And so, send positive thoughts, good energy her direction. It is fairly serious. And so she is not actively manning that phone right now. And I will be traveling some. So if you're not getting immediate responses to things, then, shoot an email, send a TikTok, an Instagram, whatever, leave us a message, and I will get back to you. It's just going to be a little bit discombobulated for the next week or two.
Well, thank you for sharing that. That's actually important. And we wish your assistant and friend, the best health and speedy recovery, and hopefully she'll be back better than ever. And there you go. So things will get back to normal. But that's life, right? And we were talking about health. I think this is exactly what happened. You're healthy today, the next day, things happen, and it kind of affects a lot of stuff, and that's the biggest part about it. Humans live, and we hope that we live a healthy, life cycle, but during our course of life, we experience ups and downs, and our health sometimes is that's why we say health is wealth, because we want to maintain it.
Absolutely.
Your job in the MD world then has been to help people physically, mentally, and you do a lot of that, and you still are active besides the speaking and the shows. You're actually doing your medical stuff on the back, which is the core part. But you really talked about somebody's got to pay for it. It ain't cheap. Healthcare in the US, and I think around the world, is not cheap, period. I mean, it doesn't matter where you have to pay for it. Somebody's paying for it.
It's a business. It is a business. People talk about it being, a noble profession, and it's our right to have good health care. And, you've given an oath to be there and providing it. You're a public servant. That's true. But at the end of the day, it is a business. And for all of those who say, but your Hippocratic oath, in the days of Hippocrates, physicians were public servants as priests were. The public took care of all of the physician's needs, and the physician just went around and practiced medicine. These are not those days anymore. At the end of the day, it is a business. The physicians have to keep the lights on. The hospitals have to keep the lights on. Somebody has to pay for that. And that's where the insurance comes in.
Well, one way for it.
That's one way.
One way for it. But we'll talk about this. There's a lot of ways within the insurance. But you're right. I mean, that's a big deal. Thank you for breaking that out, because I want to just touch on that, because you're right. And you and I think the first show we had, we talked about preventative medicine, which really coming back to the source and the roots of like what people have to do that, which kind of we lost a little bit of that, in more recent years, but it is a big deal. But you're right. The history was where doctors were taken care of. And so they didn't look and worry about the financial aspect of it. And they did it because they cared, and they still do. But to your point, nothing is free, nothing is cheap. I mean, med school is not cheap. You got to go through those years and years for a lot of money. A lot of money goes in there. And then you have all these potential student loans, whatever, or even without it, once you're actually active, whether you work for a hospital, when you work for yourself, that's even crazier, because now you have to have malpractice insurance. I'm talking about insurance. Unfortunately,
and malpractice insurance, I mean, it's a significant thing, because at the very minimum, low-end malpractice insurance will start out at somewhere between $2,500 and $5,000. And then for some providers, depending on their specialty, it can go up as high as $150,000. That's for just the insurance before the doctor can even start practicing. And then when you talked about the school loans, the average school loan for medical school is $300,000. That's what the doctor has on their plate before they ever even step into an office to start practicing.
Well, there you go. The office isn't cheap either. I mean,
you're right.
Before you even open the doors, you're gonna have to actually spend, $500,000 just to get a facility operational, staffing, and everything. And again, I mean, we're laughing about it, but it's reality. I mean, in order for you to get that service, you need a place, and that place is not going to be just, a tent. Even tents will probably cost money, because you still have to have equipment. So it's not that easy. The equipment itself is expensive. Whether it's the basic elements that you'll find in a doctor's office, but there's also things that you use, scanners and just gizmos, gadgets that you use, but they cost
cotton balls.
They all cost money, and that's the thing. It adds up, and you're right. It is costly, and therefore that actually eventually winds up at the payers level, because you have to maintain, and also you have to make a living with that too. I mean, yes, people will say, well, there's a joke about when we had this discussion the other day with a different show. When you're young, I mean, one of the things that our parents usually want you to be is a doctor, a lawyer. And one of the reasons that's always been the case is because they want you to make money, because those are good paying jobs eventually, but nobody's talking about like the cost to get there.
That's right.
And the time that you spend. I mean, I have a few friends that are doctors, and they spent many years, in college and, in internships and all those things, and get into the system before they even become, officially board certified and things like that. So that is not a very, let's get in, let's get out, then you got a degree and you got a job.
It is delayed gratification. I remember one year we were sitting around and everybody was frustrated. It was the year that we did anatomy, and anatomy was tough, and you have to develop a warped sense of humor because you're cutting into bodies and all. But everyone was a little disgruntled at that time. And so we sat down and we were saying, well, was this really the best thing to do? And someone was saying, well, from the standpoint of it being lucrative, it probably was. And then we started talking about it, and we're like, well, let's talk about the time that you put into getting there and everything. And once we finally broke it down, we agreed that the average secretary that starts out of high school, because she doesn't have to go on to college, or so she might have gone to business school for a couple of years, but the average secretary that starts out of high school and continues to work all the way to retirement, at the end of the day, if she saves her money and spends it well and invests it well, is going to make as much as a physician, because they don't have that overhead. And, people think, physicians, lawyers, all of these high-powered people make these huge amounts of money. And on the front side, it does seem like a lot of money coming in. But then once you start chunking out of it for education and all of those overhead experiences that we talked about, it's not that much money. Doctors aren't just making money's hand over fist. It all goes back into the business. And that's how businesses are run. People talk about, $1 million businesses and $1 billion businesses. And they're like, oh, folks are billionaires because they've got these $1 billion businesses, but they also have $1 billion staff underneath, people who have to be paid, supplies that have to be supplied. I mean, every single pencil in a business has to be paid for by the business. So medicine's no different that way. There's a lot of money that moves around, but most of that money gets absorbed back into the business of medicine. It takes a tremendous amount of money to fund a hospital. And that is the reason that, with insurance not paying as well as it used to, a lot of hospitals are going under. There are a lot of communities that are losing hospitals. I know I was practicing in Oakland, and I was actually working in an urgent care center, and we were becoming very, very frustrated because the people who were in the surround area were struggling because the one hospital that was in that vicinity, it closed. It could no longer stay afloat. So now they were having to drive 20 miles to get to the nearest hospital. Well, if you're a senior and you're only driving in your little neighborhood because you can't see that well, and you definitely can't drive after dark, it makes it very difficult when you lose that one hospital that's in your community. But it's happening all the time. And people don't think about the fact that we have to pay for our medical care in order to keep the facilities and things going. And, we talk about insurance as well. I have insurance. Insurance wasn't designed to be the be all and end all. When insurance first came about, it was designed to pay for what? Catastrophic care. It wasn't supposed to be, paying for your trip to the doctor because you had a cold or a sniffle. And because you paid out of pocket for your cold or your sniffle, you usually didn't run for the cold or the sniffle. You went for the serious things. Now people go to the doctor for anything. I sneezed this morning. I'm going to go to the doctor because I have insurance and my insurance is going to pay for it.
I want to talk about that. I mean, that's a big deal. But thank you for breaking that, because there's a couple elements I wanted just to touch on. One is we talked about basic school meds and stuff, but I mean, you want to get an expertise, a specialty, that takes more. And again, the degree of specialty also determines what kind of malpractice and all that. And yes, you'll make the money, but you're right. One of the things that we don't factor in is you make the money. You might live a little better and your lifestyle maybe, improving, but at the same time, you do have all these overheads and you have to run equally. And I do recall a friend of mine who may he rest in peace today. I mean, he passed a couple of years back, who was actually an OBGYN doctor and lovely doctor, great in the community in New York. And he had his own practice in, private practice and he worked at a hospital. And eventually, he decided just to keep to close the practice and just go to the hospital. It was easier, no headaches. It was a lot simpler to
be. And that's happening a lot.
It is. And that's because the cost of living and the cost of just running the business was just overwhelming. And then to your point, the malpractice and all this stuff. And it was just a wise decision. You know what? I'll be staff doc and I'm good. I'm on call. I do my thing and I walk. I don't have to worry about all the other stuff. Let the admins at the hospital system take care of it. And you know what? That's a lot of people are doing that. And you're right also about because it is very expensive. A lot of folks today, a lot of hospitals went under. Even in New York City, we've had a lot of hospitals that closed over the last few decades, and some of them didn't come back again. I mean, they just either, disappeared, or maybe some other new facilities have, or we've also seen a lot of mergers, acquisitions. So there's that. And because again, some of these facilities cannot sustain, and there are some clinics that are funded by the federal government. So the FQHCs, and those are, community kind of locations, but they're not hospital systems, and the hospitals are the ones who are really costly, and because they have other things, they have beds to fill, and we always use that expression, got to fill those beds. But imagine if a hospital doesn't have beds, filled, they can't actually, keep up. I mean, they have to run that whole operation.
Well, think about what was happening during COVID, because, we kept hearing about how hospitals were capacity packed. And, you couldn't get into the hospitals, but the hospitals were struggling and suffering, because what was happening is that the hospitals were not capacity packed. They were capacity packed according to the amount of staff that was there. But they lost tremendous amounts of staff when COVID came through, because a lot of people, anybody who was close enough to retirement, bam, they opted out. Anyone who was concerned, nurses and doctors who had young children, they were concerned about taking this horrible thing that might take their children out, or worse yet, might take them out so they wouldn't be there for their children. A lot of them opted out. So you ended up with these skeleton crews of nurses and doctors that were trying to handle it all, but you can only have so many patients per nurse. And so if you lose nurses, you have fewer nurses on the floor, that means you can take in fewer patients. You might have lots of beds available, but beds that you can fill according to your patient staff ratios are not there. Well, once you cut that down, that's less income coming in to support the overhead of these hospitals. COVID has really caused hospitals to struggle.
Yeah. And again, ultimately there was some funding and some support, but that came in later. And so that was not initially, and everybody was trying to figure this out. And by the way, we're talking about the US. We didn't have it as bad. Some countries had it even worse. We don't have to go far. Canada, and we do have a lot of audiences of Canada. They had their own struggle with it. And many other of the third world countries even had that. Europe was overwhelmed. So it was just all over. But you're right. This is the people, when we think hospital and capacity, we never actually equated to the proportionate numbers of staff that needs to be there to be adequate. And you're right. That was another thing. Most people, I've actually seen some of the discussions about it where people were clearly explaining that, and just so people understand, this is not about just too many people in the hospital, because you're right, staff was short, and some of these folks would double and triple in their shifts just to maintain, and they were overwhelmed too. And again, and that's
people were tired. The nurses and doctors they're tired, but really, I feel for the nurses. I feel for the doctors too. Doctors were overworked and everything, but nurses were the ones, the people who were on the floors, who were actively attending to the patients regularly. The doctors are kind of in and out. They're seeing a lot of patients, but they're in and out. But you have these nurses that were on site, that were providing the care. They're in the room, they're exposed regularly. And then for a while, when we were on lockdown, not only are they in the rooms and exposed, but a lot of times they couldn't even go home. If there had been an exposure, then they had to stay quarantined at the hospital. So now they're away from their families. It was a lot. The
toll on it, was for everybody. But you're right. But because of what you're saying, I want you and I, we want to exchange this and share this with people, and we want to thank all those healthcare staff workers, doctors, nurses, and everybody that actually got us through the pandemic. And they are true heroes. And unfortunately, after a certain period of time, that heroism was kind of put away with this whole vaccine thing. That we had that wave, and it was just not fair for the work that they did. And some opted for the vaccine, some didn't opt, but I think there was controversy about that, and and unfortunately the picture of the heroes kind of got diluted a little bit with that. But the fact is, we do want to recognize the work that they did and the life they saved, and they were out there, they, to your point, taking risk. A lot of people actually got sick,
yes, a lot of them did. And some people in the medical field did die.
Yes, yes.
So, they did take significant risk. And for those who did stay on board and provided that care, they really truly were heroes, and they deserve to be appreciated. They deserve to be applauded because it was a heroic effort.
Well, most of us were hiding in lockdown. We can do it. I mean, there were obviously essential staff and people that did work, but the overall, I mean, it was not because we chose to. I mean, obviously there were government mandates that you stay locked down and all that. But at the end of the day, some people were more afraid than others to actually even do that. And to your point, some just quit or just decide not to pursue. I mean, at the end of the day, it's a decision and a choice. And for those that actually decide to stay, we thank them. And while the pandemic is gone, you still are in our hearts and our minds. And thank you for all the work you've done. And I'm sure someone watching or listening, some of those folks probably did help you or someone in your family or someone that during this miserable couple of years that we've had with the pandemic, and because of them these folks are around right now and you enjoyed them in your life. So thank you everyone for doing that. But I wanted to touch on the item you said. You were on the money there. You nailed it big time when you stated about the healthcare and the insurance purpose. Now, insurance, actually, just to simplify it, is really, we can create an insurance pool right now. It's basically, we all put a dollar amount in one pool, and we will all kind of do a community thing, and we'll take some dollars to help whoever needs it. And that's kind of like the same concept in just a nutshell. But that concept is based on risk. The insurance companies that were designed to do this, obviously there's profitability and they can make money, but they have to mitigate that risk and figure out the risk in advance. That's why they use actuaries and figure out, risk and trends and tendencies and all these things. And they kind of project, some of what the cost will be for whatever, type of, person or beneficiary that they put in the policy. But the insurance, has different levels. I mean, we're talking about, to your point, someone can just pay for their care. But again, that's expensive. I mean, you can pay probably for a visit, for a doctor's visit, even a specialist, maybe some drugs, but that's another thing we can talk about. But what happens when you get to catastrophic? Now we're talking emergency, we're talking hospitalization. That's where the real toll is. I mean, you can probably pay, not have even insurance. And if you're sick once a year, whatever, if you're healthy, you can just go and pay for your doctor, cash, and you walk. But what happens if, God forbid, you get to, we talked about kidney or some serious element or some transplant or something that is just a surgery. Those are very expensive. Even insurance has insurance for that. I mean, we do have catastrophic insurance for these things to kind of, insurance have insurers for them. And that's how it is. So it's really a big, concept. It started a long time ago, but it's still the same, and it evolved. And you have commercial insurance, which basically you can buy, anybody can buy. And you have also government programs, which basically are for the folks that may not be able to afford, or their income poverty levels are lower, so they can also get that. There's also insurance for the seniors, which we refer to as Medicare. So there's different types of insurance. And I did have a couple of shows that I did over a year ago, to talk about the different types of insurance. But really, that's what it is. And they're very complex things. I mean, it's not simple. I mean, I've been doing insurance work from 1993. So I've been in it. I've been on the sales end of it, but also on the operations side of it, and the design of the benefits, and we're always involved in discussions and how it all happens. Literally how we design the benefit for someone, for example, like the policies that we put in, like when you get your evidence of coverage and you get all the benefits that are covered, there's a team that actually has to go over that and decide and stuff. There's parameters and there's cost factors and a lot of things that are being in that design. And it's not easy. And, and sometimes, yes, it does cost money. I specialize in more government programs. So we work with Medicare and Medicaid, and those are subsidized by the government. So there's more regulations and things. And guess what? While for the most part, the beneficiaries pay less or nothing, the government does, but there are co-pays, co-insurance, and those are the things that you pay. There's deductibles and premiums. Some policies have some premium, so you'll pay that. And that
let's talk about that. Yeah, let's talk about that. Deductibles and premiums, because that's one of the areas that as physicians, we get into trouble with our patients being very, very angry with us when they come in to have their visit. I have insurance. Why are you asking me to pay for the visit? Sometimes the whole visit we're asking you to pay for. Well, how are you asking me to pay for the visit when I have insurance? Can you explain how deductibles work?
Sure. Well, I'm going to break it down. So let's talk premiums, right? As it sounds, a premium is a premium. You pay for something that you're going to get back, right? And so policies, like when we talked about commercial, you pay for it, right? So that's your premium. You pay. That's the price for whatever policy you buy, and the policy is going to give you a certain amount of benefits. The higher the premium, the lower co-pays or cost is going to be, and maybe $0, across the board if you pay the highest premium, right? So I pay $1,000 for a month for me, and I go to the doctors for $0, no co-insurance, no nothing. I go to the hospital, I may have very little, whatever. So that's just the example. And then, of course, you can buy different policies. You can buy medical, dental, vision, even hospital, and there's different levels you can do. You can have a very nice wraparound, coverage, and that's going to give you a lot more, but it costs more. That's on the commercial side. And a lot of this, in the commercial side will probably fall into, businesses or employers who actually will subsidize most of it. So the employees will contribute towards that premium, but the most of the bulk, is going to be paid by the employers. But if you're not, or if you're self-employed, for example, that's where the biggest part. You own a small business, you got a bodega, you got a store, you got a little, shop. And you obviously don't have coverage, but you make an income. You're not actually at the level where you can afford, or you can apply for some government subsidy. So therefore, now you have to buy your policies. Those are expensive. Again, depends what you buy. You can buy a basic minimum where you can get a doctor's. It's all right. Oh, there is. You can buy a doctor's policy, meaning that you can just, like basic, where you can go to the doctors and just, it pays for you. You can buy some level of medicine, whatever. And there's different, configurations that insurance companies will come up with. But that's on the commercial side. But let's answer your question. So that's a premium. That's what you pay for it. The deductible is the minimum amount that you would pay before the insurance kicks in. Let's be clear. So if, let's say, you have a policy, it's like if you have a car. I mean, most of people have a car and you have to have insurance by law, right? So when you buy the policy, they tell you what, you want a higher deductible, your premium is going to be lower because now you're going to pay a lot more before we can cover you. You got $1,000, $2,000 deductible before the company even pays your damage. Same thing for your health. You go to your doctor. The doctor's visit $100. And by the way, for most policies, the doctor visit or the preventative care will be $0 included, so it will not be that. But for anything further or different visit, you'll have to pay. But let's say I go 10 times to a doctor, but my deductible is $1,000 and the visit is $100. So I have to actually literally go 10 times before that insurance kicks in at 1,001. So I have to. That's exactly what it is. So now the problem is it's not so much about the policy and how it's designed. The deductible is not a very difficult concept. I think when you buy the policy as consumer is the education part. And, being on the sales side of it and being on the leadership of sales, and we train people to make sure that they educate the folks and the beneficiaries properly, being compliant about that is a key. And you have to break it down. That's why in the government programs, we have so many things. I mean, so many documents that we submit and have and give to our beneficiaries, such as the summary of benefit, which is the basic element of your package. Then you have your real evidence of coverage, which is your contract, and has all the breakdown of all the benefits, everything that's covered. With the little tiny thing like the copay, what it is, what is covered for, and so on. So we do that. But the education, if I am signing you up or giving you a policy, but I don't explain to you what's covered, and it is a fact. This is I'm ashamed to even say this, but it is a fact that unfortunately there are elements in the industry that may not be as clear and thorough and meticulous about sharing the value and sharing exactly the policy because people are afraid that you're not going to buy. Right. So they cover things, they give you something or they fluff it up or they just go by, like they do what we call drive-by presentations. And so you're not getting the bulk. Yeah, it's just like, and then, but what the hell is covered? I don't even know what's covered. I mean, we covered this, we covered that. But when it comes to what is the true coverage? Yeah, you cover doctor visit, but what is that? What's the cost? You cover hospitalization. What's that going to cost me a day if I stayed in the hospital? But some people may not have that. And then, buyer beware kind of concept gets in. Now you have to really read the stuff. Right. I can tell you this.
That's important. I mean, that's really an important factor. When they push those papers in front of you, take the time to read the fine print. Just, I've got to buy it. So whatever it says. No, all insurance policies are not created equal. And you need to know what you're buying so that if you bought an insurance policy that says that you have a deductible, you need to know whether your deductible is $100 or $100,000. That's on you to know that. So take the responsibility to read those documents. It is worth your time.
It is. Well, for the commercial ones specifically, especially those that you pay individually, that this is your buying, this is your money you invest in. We're going to talk about different levels. So we'll talk about that. You're buying a policy. You need to know what you're buying. Why is your premium going to cost you X? What will be the other expenses in your policy? Meaning that now that I have the policy, great. It starts effective the first of the month. Great. So what can I do with it? I go to the doctor. How much is it going to cost me? Is there a copay to my doctor? So usually the PCPs or the primary care doctors, it's a low copay or no copay, right? Because that's the preventative. But then you have these specialties. Some seniors, for example, and we'll talk about seniors, but in general, if you have any type of illness, you wind up at a specialist. Specialist rates are different, right? The copays rates are going to be different. A specialist doctor may not charge $100 for a visit. Their current self-pay will be about $200 to $300. Depends where you stand in the stage, but still, that's a cost that's going to come out of your pocket. So did you know that's what it's going to cost you? That's your premium, my primary care visit, my specialty visit. If I go to the hospital, what will be that? My emergency cost. If I get an ambulance that takes me to the hospital, what is my copay to that? What will be, and by the way, copay and coinsurance, one is a percentage and one is just a fixed amount. So copay is how much I'm going to pay. I know I'm going to pay $25 for this, $90 for that, based on each service. But that's where that summary of benefit comes in. It breaks it down to a science. So every element is enumerated. It's like a list, like a menu. Like you go in a restaurant, you have a menu. So you eat, and this is what you got to pay for. Same concept. But every single element is broken down to you. And then you have to know that. And that whoever your agent is, should be able to go.
I like that analogy. I mean, because you would not go into a restaurant and just put your finger on the menu and say, "Well, I'll order this," without reading what is in the order.
Right. That's right. And you're not gonna. And here's just
perfect analogy.
Yeah, just bring them, and then like, oh, what the hell happened? I've seen that actually in cruises. But not on the food. They do it on drinks. They drink, and then they get a $3,000 bill at the end. It's like, I didn't drink all this. Nice, yes, you did.
Yeah, you did. Actually,
I actually see that, and it's not a fun time to be that person, and it's not
really a pretty picture.
I know, but that's really what it is. So you have these elements in your insurance policy that you need to know, and you need to ask the question. So what if I go to the hospital? What is my deduct? That's the other thing. For the hospital, there's also a deductible. When you go to the hospital,
that deductible is on top of your other deductible. So it's not all one deductible.
It depends. So there is something what we call the maximum out of pocket. So all your medical care together, cannot, and it depends on some policies. They give you that ceiling, right?
Yes.
So the worst that's going to happen to you if you ever go bad, you're going to pay $10,000 from pocket, right? But you have to know that that's in the policy, because if it's not, cleared there, then it doesn't matter. You get charged, and you wind up with $100,000. There's nothing you can do about it. And that's why we've heard horror stories about people losing their homes, going bankrupt because they have nothing, else to pay these elements with. Now there's tricks, and we're going to talk about that.
Let's talk about that. It
does
not matter.
Let's talk about it.
It does not matter how good your insurance is. There are things called catastrophic caps. An insurance company is a business as well, and they're not trying to go into the hole. And at some point in time, your healthcare can become so expensive that the company says, we can't continue to finance this particular hospitalization.
Thank you for that. But I want to add that. But that's the other thing. You said something very important. The fact is, every year we hear people complain, my premium went up. Well, I'll tell you why it goes up. Just like car insurance, the more accidents in your territory, the more everybody else, rates go up. Well, same thing. If you are in a policy, let's say I'm company X and I have, 100,000 members, and I factor in a certain amount of dollars that's going to be my cost for the year, give and take. We have some groups that will be extremely sick, some are very healthy, and you kind of factor in those risks and you kind of wash it out based on what that is. That's all there is. Basically, you look at your sicker population versus not, and then you kind of figure out what that costs, and then you develop the premiums that's going to still make you cover your overhead and have your profitability if you're a profitable, company or for profit. But then you do all that. That's great. But now what happens if people are getting sicker and sicker, and that pool of sicker people gets bigger and bigger in that 100,000 members, then the cost is going to get, broken down to everybody. And then next year's premium are going to just climb up. And that's exactly how this is as simple as that. It's not rocket science. It's really cost and just, effect. It's just numbers, right? You add.
Now here's a question for you based on that, though. A curiosity question. We know it goes up that way, but what if you have years where people are less? Does it go back down again?
To be honest with you, I have not seen that on the commercial side.
Right.
Because of inflation and everything. But I know in government programs that can change, and we can talk about that. But that's also depending on which market. And that's why also some policies sometimes disappear from a marketplace, or some companies even move and they don't service areas. And there's a lot of stuff that goes into this. So you look at your population that you're servicing, and then they look at it. I mean, again, there's mathematical stuff that is going in the back end of insurance. That's what actuaries are the biggest piece of insurance. They figure things and they do all these assumptions and future forecasts, and they figure all this stuff to make sure that they get their profit margin, whatever. By the way, you said it well. It's a business. Because
it is a business. At the end of the day, it is still a business.
But it's a business that does support you and help you. And I want to be clear about that. See, people, we don't want to undermine the fact that we need the insurance, because unfortunately we don't have healthcare covered 100%. That's the bottom line.
Right.
If we did, and by the way, we can talk the example of Canada next door, right? And I've had I've had multiple discussions with providers in there, but here's what happens there. Yeah, they do have the social healthcare, as they call it, but there's ramifications to that as well. There's downsides to that. I mean, the long term, the long wait, things like that, the taxes that they pay are higher. But you still, if you wanted to privately go in Canada, you can. But it's going to cost you more. You're just going to pay for it. Same thing. So they do have the ability to do that. Canada or the US, the US actually has no real healthcare system that is open public, other than if you fall into a certain category of income and resources, and therefore you qualify for state, government programs or federally, mixed things such as Medicaid or Medicare. But those are specific groups that qualify. Not everybody does. And so if you're making just a little bit over the threshold, as a matter of fact, there's funny in its reality. If you don't have money, you're good.
Right.
A lot of money, you're good. If you're middle class, which is the majority of people fall in that category, that's where it's bad. And that's what
this is a good place to make a point, though, for the people who say, well, I think insurance is ridiculous and I'm not going to spend the money on that insurance. Again, one catastrophic illness can obliterate all of your savings. I mean, just wipe them clean out. And you may go from being middle class to being able to qualify for Medicare or Medi-Cal, because the expense of a hospitalization, it is not uncommon to have $500,000 for a hospitalization. That is not uncommon. And very few of us have $500,000 sitting around in our savings account to say, oh, I'm just going to pay out of my HSA, health savings account, and I'm just going to pay cash for my health care, and it's going to be okay at the end of the day because I just have money jumping off of the top of my head. Most of us can't do that.
By the way, thank you. You mentioned HSAs, and when you think about it, those are like, insurance is HSAs on steroids for others.
Yeah.
Because really, an HSA is for you and your family. So basically you throw in the dollars and it's pre-tax, whatever, it's yours. And then you just pull that money available to you. So whatever you put into it is available. But it's the same concept for insurance, but it's mixed with other people's money. And by the way, similarly, the banks work the same way. Banks don't have money. Yes. They just, people put their money there and then we just borrow from each other's money and the bank just manages that for us, right? Well,
yeah, I mean, it's all crowdfunding at its finest.
It is, exactly. But the health versus not health, do apply. These risks and things like that are mitigated. But you're right. You go to the hospital, somebody who has a chronic disease or something that gets more expensive, and they go to a hospital. You stay in the hospital for a few days. And by the way, the lowest hospitalization is a couple of days, 3 days, I think. That's what before he gets discharged. So if you're there in 3 days, that's already like $10,000, and I'm being nice about it. So
that's before they did anything to you, just to be there.
Exactly. Well, again, if you wind up to the ER, most people come to the ER for those cases. You wind up there. ER alone is about 4,000 or 5,000, even 6,000. That's just one. Boom, you're in, and then you get admitted. Now you have hospital stay, you have food, you have this, you have that. Medicine administered to you. If you have any procedures, surgeries is another rate. The doctors have their own rates. Everybody, the MRI has its own rate. The X-rays have the CAT scans. Everything adds up. And before you know it,
that you are being charged for everything. Every Band-Aid that they put on you, every cotton ball that they use, somebody has to pay for it. And that is either you or your insurance. Somebody's paying for it.
Yeah, and by the way, that's exactly right. Somebody's paying. There's we have a rule in the government programs, regulations. So when we market and talk about benefits, we can never say it's free,
right?
Okay? Because it's actually not free. There's nothing free, and there are people that say there's nothing free, which is true. There's no one that gives you free stuff. There's no free ride, right? But the fact of the matter, it's not free because maybe no cost to you or low cost to you, but it's not free. Somebody has to subsidize 100% or partial, percentage of that, but somebody's paying. So
and everybody talks about socialized medicine where, we don't have to pay. Oh, you're going to pay. You just may not pay up front. It's going to come out on the backside out of your taxes. So you're going to pay one way or the other.
Well, but let's face that. Let's talk about that quickly. Again, I love it. Let's talk about it. See, that's exactly the topic of the show. That's the heading. But the bottom line is this. There's everything costs. The only way everything will be free if there's no cost to nothing. Meaning the bank doesn't ask you for money.
Right. That is exactly
no one pays for nothing, and everything is available. I had this discussion just last week. Literally, we had just a fun discussion. And I said, you know what? If we did something very simple, we'll give everybody a system where they all have housing, school, healthcare, and stuff to a threshold, meaning that you have a ceiling. So everybody gets, let's say $100,000 a year. Okay. And that includes your property, and you can get a property guaranteed for $300,000. That's your max, and that's prepaid, and you don't have to do anything. That's already there. Your school is paid, your healthcare is paid. Now how you kind of differentiate people in terms of class or whatever you want to call it, or level of poverty. Then we go from that element up, meaning that if you want to buy the next level house, then you work for it. but so it's a system that can be designed, but I don't know it's going to benefit because there are parties that would not benefit from this formula. And, we can talk about the politics of that. But the fact is, it can be fixed. And it could be, if people have the basic social elements, which is, again, health, shelter, food, things like that, that you don't have to worry about. And that's a good start. And again, people will refer to that. That's social, system. Maybe to a degree, it could be a hybrid, whatever the case is. But in our world, it doesn't work that way. You pay, it's not free, someone is paying. And at the end of the day, when we say someone is paying, you're still paying no matter what. Because if your employer is paying, you're working. Exactly. You're contributing to that, right? If your government is paying, you're paying taxes. You're still paying. It's still you. No matter how you slice it, it's always
going to pay no matter what. You are going to pay one way or the other.
And by the way, when we say government, our businesses, we always refer to the entities. But there are still humans that are running those things, and they all are participating in the part of society, and they all have a contribution. Now, some people make more money and they don't care and they can afford it, and and they get richer, as we say. And like the expression said, the rich get richer, the poor gets poorer. And I don't. This is not a politics show, but you said but these are facts. We know those. And in the insurance world, there is that. I mean, it helps. I mean, we've often heard about these big companies where you have these CEOs and senior staff that are living a decent life. But yes, they do make money. And by the way, I mean, it's lucrative, and I can't complain. I can tell you I made a living that way too. But not to that rate.
Let's talk about that a little bit too.
We can talk.
People get jealous so to speak, about people who make those lucrative incomes. And you made a lucrative income. That lucrative income didn't come free. You worked your butt off for that lucrative income.
Yes.
You work harder for those. I mean, they're not just paying you because you're cute, you know?
That would be nice, but that's not the case.
Yeah. They pay you to work hard. So when somebody has a big income, ask yourself, what are they doing for that income? What are they willing to give up for that income? And a lot of times what they give up is time, because it takes time to build those kinds of incomes. It takes time to do the jobs that command those kind of incomes. Those people are usually not going home, punching a 9-to-5 ticket and going home. They're usually working long hours. They're working weekends. They're taking work home with them. They're taking stress home with them. They are paying for that income. So before you get yourself wound up because you don't have that income, ask yourself, what do I value? What am I willing to give up to be at that income? Or do I like it where I am right now, where I don't have to give up as much time, or I don't have to put as much into getting? Is this where my quality of life is? You have to determine what works for you. And if you're happy with what works for you, then don't begrudge someone else who has got a little more financially, because they are paying for that financial benefit. So just think about that.
Well, I think we can have a whole show just for that. but it is. I mean, we can talk about it too. But here's the thing. Just briefly, I can speak on myself. I mean, when I started, I was just a sales representative, and I mean, not shame. I started my salary was $21,000. And I was working 7 days a week, and I was doing weekends. I was working 10 hours. Sometimes more than that. Evening events, whatever. Didn't stop. And then you had to move the ladder, and it took time to go to the next level and next level and next level. And 27 years later, I can say that, but I worked my butt off to do that. But you're right. It's not easy. And there were sacrifices made, I mean, I remember I used to take my family with me to these events. So I'm working, they haven't, and then we kind of make it a family affair at the end of the day. So I manage it so I can have both balances, or balanced life and this, but it is not easy as, just like, okay, you do this. But people can say, well, that's you. But, we still see these guys that drive the big cars or whatever. Well, listen, when you make the money, I mean, you work there's a purpose, your goals. I mean, for me, success, span, everybody wants to be successful. And that the difference of success depends on what you want, what your goals are. If my goals are just for me to just have a nice little trip with my family, and that's okay, that's great. That's your goal. You work towards it. It works. Someone wants to have success. That's your success that's what you set for yourself. To your point, it's what do I want? If I don't want to do anything, some people says I'm not materialistic. I don't care about all this stuff. I want to live in a small. I don't have to have a mortgage. I just pay my home and live happy. That's also success. It's all good. Nothing wrong with that. I know today's show is really not about that. It's about just the concept of health care and insurance. But we can do actually come back and really talk about that in terms of success and determination, motivation, and really, just everybody has the same abilities and they can do the same thing. And, but it depends on the choices we make and how we really want to, and which path we choose. And yes, it will be a price. There will be a price. There's no doubt. The price could be a family, your time, your health, a lot of things, your stress, depends on the job you do. I mean, I've been in this industry long enough, and there's some jobs in the industry that are very quiet. You go in, you do your thing, you leave. I chose one of the more difficult ones. I've been in sales, and sales is pressure. Every day there's not a dull moment. Every day there's something going on. It's hard. It's numbers. We have teams, like I have teams, but the pressure that goes on me goes on them, and vice versa. And so it's a very, very, a high tense, element of life, and, I'm more now on the downside, I'm doing this, and, eventually this will be my new thing, in the future. But the idea is, I know how that went, and it's easy, but it's not easy. Rather, it's difficult, and you have to make, the right decisions. And sometimes, it takes a toll, so that's that. But again, we talked about the cost and the financial gain in these insurance and institutions, but that's a portion of things, but the idea is that you still get your services.
Right.
Remember, so yes, you pay for it. It's not free. You would, by the way, if you were going to pay, this is the part that's very simple. You can go to a doctor and all your services and you can pay for them. You have cash, you're going to do that. But to your point, what happens if you break something? What happens if you, have a major surgery, your heart, whatever, you get a stroke, whatever,
catastrophic event.
Catastrophic. There is no pay out of pocket. You will pay everything you have because that's what the cost is going to be. Insurance will almost reduce that risk and take most of it and then kind of mitigate most of it, will deduce and reduce most of the cost that you will have, and you will hopefully walk up with it. That's exactly what you're going to pay, your deductible.
Right.
And that will be everything that you're going to pay. And so if you have the maximum out of pocket is 10,000, 5,000, whatever it is that you buy, that's what you pay. Same thing with cars. Again, you drive the car in the wall, but your deductible is $1,000. The insurance pays the rest. You're good. Your premium will probably increase next year, but that's another story.
Right. Yeah. That's a guarantee.
It is. By the way, it's funny. I had this happen to me a few years back. This is not for health insurance, but it was property insurance. Same thing. We had a snowstorm, and I had a leak on the roof, and so they had to pay for the new roof. It was $17,000. So I was paying, I forgot it was $800 a year. After that, the premium went to $3,000 a year.
Ouch! Ooh.
so I called them. I was like, "What the hell?" I mean, I paid all these years, nothing happens. You fixed it, and you want to make it up now? I was like, "Okay, I'm switching policies." And by the way, that's exactly what happens even in health insurance. Some people do this. I'm not giving you guys tips, but I'm telling you what happens in reality. People will do that. They get their benefits, and they move on to another policy. Now, the problem is, that's why some insurance companies, they have medical stuff. They require things. They want to see if you have a history. They have medical, problems or whatever conditions before they can give you, whatever that policy is, and then what the cost will be determined based on those underwriters, and they will actually figure out this stuff. Just like life insurance, they're going to look at things. Some health policies will determine that. Now, not all policies have that. Depends what you get. The premiums will vary. The benefits will vary according to how much you're going to pay. I want to pay, like I said, it's very, you either pay up front or pay at the end. You pay a higher premium, you have lower cost. You pay, you want lower cost right now or no deductible or very lower premium, that's fine, but you're going to have a high copay for everything. Instead of paying $10 or $0 to my PCP, I'm going to pay $100. Instead of paying $200, $40 to my specialist, I'm going to pay $300 to my specialist. And so it's all going to be there. Somebody, like to your point, it's very simple. It is going to be paid one way or the other.
Right.
And we're talking right now just for the commercial piece, but I do want to, and I know we've already, kind of crunched in the hour today, but we can probably do a sequel to this because this is fun stuff.
Oh, absolutely. It's important stuff.
It is. And it's a topic that touches everyone. And by the way, whether this shows, I know these shows are broadcasted all over the world. And even if you're not in the US, you probably can relate to some of this discussion. At least you might be understanding how it works. And in some countries, it's even worse. And we can talk about that too. But I can tell you, you mentioned something about people going to the hospital for everything.
Right.
When I started in the insurance world, so I started in the Medicaid world. And at the time in New York, they had what they called the demonstration project, where they wanted to test the Medicaid mandatory stuff, meaning that they wanted, if you were to apply for Medicaid and, you qualify under certain categories, you will have to select the plan. So there were only few plans in this demo. And I happened to be one of the first reps in that first industry as it was launching at the time. And, one of the things that we've noticed is that people were literally going to the emergency room for flu or cold. And this is how it happened. I mean, anybody Band-Aid. Anybody get a cold. I mean, we've all had colds in our lives, right? And usually a cold has a couple of days before it dissipates, or even a flu will go on its own. I mean, if it's not severe. And so, you'll sustain it, some fever, this and that. But people, the first day they have it, they don't go to the doctor because they don't have a preventative method. They're not used to prevention. So they're not like, I'm going to check on my doctor. Let me call my primary doctor and see what's up. Let me get some, prescription. I'll be home and relax. First thing, they wait, and then they go straight to the ER. I got a cold.
Right.
Okay, great. So you got a cold or sore throat the next day. So it's a $3,000 bill, by the way, just by walking in, right? Yeah. So now you're in emergency. And then the cold doesn't go away in 2 days. I didn't like the doctors. I go back to another hospital now. And so in that time with the government programs and Medicaid, was really used just like, and it still is. It's a credit card for your health, basically, right? That the government pays, or actually the taxpayers pay, but we can debate that. That's a different story. but so you go in, you swipe it at the hospital, they take it, and they bill Medicaid and stuff. Now, the other thing that happened then, this reality, is that because also the government realized that they paid less. So now these services were duplicated and triplicated so they can get enough money to supply. So for example, I go in for a service that is $100, the government's going to pay me $10. Guess what? I'm going to do 3 or 4 times and I bill for $500 because I'm going to add it up so I can get the $100 I need. And that's how it was. So it became a little bit of a game over time. So the demo that started for the Medicaid at the time was to kind of stop that. So the idea is that we're going to give these insurance companies, and they were doing this in the commercial world very nicely because that's what they did. And they know how to do this care, and we would know. And what we're going to do now, we're going to say to the insurance company, if you do this program with us, we're going to pay you every month certain premium for every member you sign up. So you have 10 members, you get $1,000 per. This is how much you're going to get a month. What you do with it, we don't care, but we want you to cover this. So the companies have to go to the table, to the drawing board, and they have to run it up into a program and figure out what they can fix in that amount of money. And then they do contracts with those providers and say, for these services, we're going to pay X, Y, Z. And if you agree, now you have stuff and you have to see our members. But that's how it's designed.
This was basically the principle behind things like TennCare and Covered California, correct?
Same concept. Yeah. I mean, all these programs are similar. I mean, New York happened to be one of the first ones that did it. And I think California was up there too. And but Medicaid World, which is basically the program that is from state and also subsidized by the feds, that program is really the basic elements where you are on a certain level of income and or resources. By the way, this doesn't mean that you don't have money. You can make money. You just cannot make a lot. And you can have a house, you can have a car, you can have bank account, but you can have a certain amount of dollars. This is not welfare, just to be clear, because sometimes some people connect those two dots and think it's the same. It's not. But that's a whole different discussion, because a lot of people, I don't want to be Medicaid. You can be Medicaid. I had Medicaid. I mean,
There's nothing
I was
wrong
between
with
jobs and I had it. It didn't matter. So but the fact is, it is insurance that you qualify for when you qualify for it. But then the problem is the use of it was kind of weird. And by contracting with, private insurance companies, they were able to control it. Because I know as a government now, there are 100,000 people assigned to this program. I know I'm going to pay 1,000 to each one of them. That means it's $1 million, whatever the number is. I'm going to give to these and this. So I know in advance that it's going to cost me $1 million to cover these people. However, if I don't have this formula and the people just keep going as they wish, guess what? I don't know what the cost is going to be. It could be $10 million because they're going to keep showing up, and that's it. And that was like just losing, no controls. They put these.
I would see that when I was in the military, because the military, again, is one of these managed care kind of programs. And I was working the outpatient clinics, and people would literally come in to get a Band-Aid. Like, why don't you just buy a box of Band-Aids and save yourself the trip? Nope. I can get a Band-Aid here for free. And they would come in, for their Band-Aid.
Well, education was a big piece of this. Let me tell you, the amount of times I got cursed back in the days.
Oh, yeah.
You tell someone, I heard all the F words that you can possibly hear, because people would be like, I'm not going to give you my card. I can go anywhere I want. And you want me to go a specific network and the doctor, and I have to select, and I can't go here and I can't go there. No, I don't want this. That was the reaction that we used to get back in the days, because until maybe 10 years later, when it became fully mandated. So if you if you are Medicaid eligible, you have to pick a plan, period. You have 2 months and you're in the plan, whether you like it, we assign you a plan. But before that, because it was optional, people were like, so the joke is that our first insurance company made the actual membership cards gold, like the credit card, like the gold American Express. So we used to go, and it was literally a gold card. So you get it. So we used to say, here's your gold card. So you can go to your doctors and stuff and pay for your care. And that was it.
I have my gold card.
I know. And people would be like, I got the gold card. And so that was actually really it. And it was just in time with education, it was good, and hopefully, today it's almost a standard everywhere you go. If you qualify these programs, you're going to choose a plan. It's not on the Medicare side yet. So Medicare has managed care as well, but it's limited and people still have other options. And we're going to talk about them maybe at the next show.
Right.
We can do that. But yeah, so that's kind of like, so we were just literally covering premium and deductible today. We haven't even gotten to the other stuff.
Yeah.
But
yeah. I mean, it's a whole lot to unwrap. I mean, insurance, to really understand it well, it's a whole lot to unwrap.
It is. Well, again, this is just the basic stuff. Now we talk about the interaction between providers and insurers. That's a whole thing. And that's a whole chapter in itself. Because the way the contracts work, the way the stuff works, the elements of submitting and getting your stuff through, and doctors are not really pro insurance, especially government programs, because they're, first of all, they're not getting the reimbursement that they want and things like that. But that also changed because the Medicaid changed everything. The Medicare changed the way they pay the doctors. In the commercial stuff is a lot simpler. Very easy. Doctors like it because they get paid a certain amount. They know what they get paid. They're happy. It's good. There's less complication. In the government sector, it's a little bit more complex and it gets a little crazy, and that's where most of the doctors are not really thrilled and happy, but they have no choice. I mean, over the years they had to adapt to it, because it is, if you have Medicaid, you have to pick managed care, right? Because Medicaid really pays the least. If you have Medicare now, you want to be in a health plan, especially in some areas like New York City and some of the big metropolitans. You want to be there. Now you go somewhere else, depends on the income brackets, whatever. People may choose to get MedSups or Medigap policies, whatever. And we're going to talk about that in the next chapter on this discussion. So I think we've covered enough, but I just wanted to close with a couple elements. One is just, I mentioned something about copay, which is basically the amount you pay as you go for whatever service. And the co-insurance is, there are things that are not a fixed number, but they say you're going to pay a percentage of, whatever the cost is. So you get some, for example, in drugs, usually if you get to a tier 5 drug or like a specialty drug, they don't have an actual copay for it. They have a co-insurance. So you pay 15%, 20%, 30%, whatever the drug is. So God forbid, like cancer drugs, for example, they're expensive. So those are catastrophic.
They are prohibitively expensive. It is not uncommon to see a cancer drug cost $35,000 a month.
It could, and so guess what? You're paying a percentage of that if you don't have the right insurance. And by the way, for cancer, if you have private insurance, very little. There's a lot of tricks about that, but there's also a lot of limitations. A lot of the institutions that are treating cancer probably don't take much insurance. That's the other thing. So there's a lot of tricks, and it's very complex. Again, the healthcare system is not as one simple process. There's so many moving parts. So we covered again premium, deductible, copay, and co-insurance, and those are your basic elements. And then what's in between? It's just the services that you get and what you get and how you get them and where you use them, and the different elements and how to operate in the insurance world. And then we can also talk about how the interactions, the system, the benefit design. We can talk about that. I kind of alluded to it a little bit earlier, but we can deep dive on it. I do want to talk about, like we said, the interaction between the providers and the insurance, which is in its own, it's a very complex process. And, and we can talk about anything else. Let's talk about it again next time.
Absolutely. So this has been a great conversation. Like I said, there's so much to unwrap with it. This can be a conversation that can be going on for a while, talking about, what the insurance is, how it works, how it affects the providers, how it affects you as an individual, as a recipient, and what your insurance is actually doing for you. So this is a conversation that we will definitely continue in the future. And I absolutely love having you as a resource to break some of this down, because we don't get to see it from your side. We don't get to see the workings of the back end, and both the clients are frustrated and confused. Physicians are often frustrated and confused. Hospitals are slamming their heads against the walls, and we don't necessarily know what's going on the background. And I appreciate the honesty of your statement in the beginning that not all of the players are always on the up and up and doing the right thing. And that creates issues as well. And that creates perceptions of what insurance is, not what it's supposed to be, but what it is, based on a few bad players. And the majority of people working in the insurance industry are not bad players.
They're not. That's right.
Yeah.
And just doctor, just to add to that, I mean, and again, on the next chapter, we can touch on that further. But the fact is, if you are selling insurance, by the way, just any producer or as insurance agents, they have to be licensed and they have to go through scrutiny and fingerprints and all the stuff. So it's not like, it's not, this is not an industry that we are just, they don't hire just, anybody that may not be scrutinized. There is a process to be scrutinized and be in it. But you're right. There's still,
I mean, that is important.
It is.
The insurance industry is a licensed industry. So if you're going to purchase insurance, don't just purchase it from Johnny on the block, because Johnny on the block may not be certified, may not be licensed. Know who you're going to when you're purchasing your insurance, because not everybody has your best interest at heart. So just, again, that's one of those things, you read the fine print, you research, if you're buying insurance, research the insurance, compare the policies, compare the plans, compare the people who are selling those plans to you. Know what you're getting. It's your responsibility to know what you're getting.
And you said it best. I mean, there's plenty of options. You have the right to actually choose all of them and, look at all of them, compare all of them side by side before you make a decision. There's no rush. Usually these policies start once a month. I mean, for some of these policies, some of them are annual, but at the end of the day, you should be able to know what you have. I mean, if you're obviously through an employer, that's the other thing. It's different because they give you what they give you and you have to pick.
Right.
But if you have to select on your own, there's that. If you're in the government programs, you have plenty of choices. Do your due diligence, find out. There's brokers that do this for multiple agencies. There are, captive agents that work for specific plans. There's so many options, but at the end of the day, it is regulated. It is licensed. There's different departments that control this, from the Department of Health to the Department of Insurance to the CMS, and there's plenty of other agencies that can be involved in this process. So it is not an easy thing. And, but yeah, there's a lot more that goes into your healthcare and your insurance.
Okay, absolutely. And Hurricane, I mean, this has been great conversation, and we had talked about talking on mental health and mixing it up, and time flew right by in good conversation, as often is the case. That's how we ended up with the 2-hour show last time. So again, I'm going to be thrilled to bring you back and to have this conversation again and again and again. And we'll just unwrap it all until people feel like they understand it. And we are open for the questions. Send us those burning questions that you have about insurance, the things that you don't understand, and we'll make sure that we touch on those and address them until you feel like you do understand, because we want this to serve you. Again, this is our show, Chatters That Matters. Let's talk about it. And our primary and sole reason for being here is for your benefit, for your education, for your entertainment, for your pleasure. This is your show. We're here for you. And Hurricane, I want to thank you for joining me on our first real show with all of your expertise, and you're a great host, you're a great guest, and I appreciate you joining me and doing this for us. A great way to start Chatters That Matters, and let's talk about it.
Well, thank you, Doctor, and it is honor and pleasure, and it's our mission to serve and really give the resources. And listen, I'm here. I always said, I learned some stuff that it's good to actually share with people, and that's exactly what prompted me to start my channel. But now with you and your show, and we're gonna mesh it up, and your other content will be also available to our folks and audiences. So please take it, sink it, take as much as you can from this. It's all for you folks listening, watching in. Doctor, thank you for the opportunity to be the guest this time.
Yes, absolutely. And as Hurricane said, this information will be out there for you to share and enjoy. You'll be able to find it and links to it on our websites. This is hosted on iHealthradio, which is also leads over into iHearthradio, and you can find it on Spotify, YouTube. There are so many places where you can access our shows and this information. So we want you to use it, choose it, enjoy it. And again, welcome to Chatters That Matters. Let's talk about it. You can read more about us at thecelebritydoc.com. And we look forward to being with you here on a weekly basis. We will usually be here at 7 o'clock p.m. on a Monday evening. But if you look at the scheduling over on iHealthradio, you will find these shows will recur in different places. And if you miss it, you don't have to feel like you missed it, because it'll be there for you to visit and revisit and enjoy. So thank you to iHealth Radio for being the basis of our show. And thank you, the audience, for joining us and letting us be a part of your experience. Chatters That Matters. Let's talk about it. I'm Dr. Cheryl BryantBruce, MD, the Celebrity Doc, and I am here with Hurricane H.
Thank you, Doctor.